Welcome back to Studio 10. In today's Healthy Living with USA Health, we're talking about pediatric bariatric surgery with Dr. Katrina Weaver. She's a pediatric surgeon. Good morning to you.
Good morning.
Yeah, very important right now. So first I want to ask you what obesity is and why does your team care so much about it in children?
Yeah, so obesity affects about 1 out of every 5 kids. And it's not just that we have overweight children, it's that we also have the associated medical problems that go along with obesity, which include high blood pressure, diabetes, obstructive sleep apnea, just to name a few. And then also in the adolescent population, we deal with a lot of bullying, which comes a lot with psychosocial complications that go along with it. And so that's the biggest reason that we care so much about what's going on with that.
Yeah, so let's talk about the surgery itself. So what is pediatric bariatric surgery and what does it entail?
Yeah, so it's just like in the adult population, which has been around for a long time, but we found with studies that if we get them earlier before we're very super morbidly obese, that we can actually reverse these health problems. And so the majority of our patients undergo what's called a sleeve gastrectomy, where we take about 2/3 of the stomach out. And so it's both a restrictive procedure as well as that portion of the stomach that we take out is where you secrete a hormone called ghrelin, which is what makes you hungry. And so we've had really, really good results to where they can lose about 30 to 50% of their total body weight.
Wow. So who's a candidate for weight loss surgery in this instant?
Yeah. So basically, a child that has a BMI of 40 or greater, or someone who has a BMI of 35 with associated medical problems that we just talked about. And then they go through a pretty rigorous schedule ahead of time where we do at least 6 visits with a medical provider. The one in our institution is called, his name is Dr. Daniel Prudhomme. And then they also do psychological as well as dietitian evaluations. And it's mostly making sure that they're ready for it because it's just a tool that they use to try to help them get to where they need to be.
Right. And if a kid does get that surgery, what does recovery look like? We know that's probably tough for the children and the parents.
They actually do really well. And so it's funny because the parents are like, they do so well, better than what they expected, especially because they have to do a liquid diet for about 5 days before surgery. And so they're in the hospital about 2 days. We do them robotically, and so it's very minimally invasive. There's very minimal pain associated with it. They go on a liquid diet for about 10 days after that, and then we slowly start introducing other foods into their diet. And the best part is they are so happy afterwards because they're seeing success and they see it right away.
Wow, that's amazing. So it sounds like short term is amazing. What does long term look like for those patients?
Yeah, so usually they lose the majority of their weight in the first 1.5 years, so that 30 to 50% of their total body weight. But then the other thing on the health side, we can actually see reversal of their cardiovascular, their diabetes. The 2 patients that I've done so far that were type 2 diabetics and insulin dependent, we had them off of insulin before they left the hospital, which is a huge factor. And so not only does it help with their fertility, because a lot of them are infertile, but it helps long run with their medical problems.
Wow, I just learned so much today. So I hope you did too. And of course, you can find more information on their website. We'll have more information on our website as well. Thank you so much for sharing all this with us here on Studio 10. So you can find that under the Healthy Living tab at fox10tv.com under the Studio 10 tab. Time now